The first trimester of a pregnancy is a hopeful time. You learn you're less than 9 months away from a bundle of joy and start dreaming of the new little family member. During the second trimester, you start to feel your little one flutter around in your belly. And in the third trimester, those flutters turn into, well, kicks and punches. This is when it starts to get real. Then there's the fourth trimester. Yep, you heard right. The fourth trimester. It's an equally important part to the journey to parenthood. A journey that should include a trip to AquaCare Physical Therapy. Lisa tells us why.
Any woman who has experienced childbirth will tell you her body is never quite the same once the bundle of joy arrives, especially during what's considered the fourth trimester.
So it's the first 12 weeks after someone has a baby, and it's a exciting time and a scary time at the same time.
A time when a new mom can experience issues not normally brought up during her 6-week postpartum appointment.
So they may experience problems with getting back to exercise. They may have problems with what we call diastasis recti, where the abdominals have kind of spread apart and become weakened. They may have pelvic pain.
Common problems that should not be accepted as normal symptoms after childbirth and can remain years after. That's why AquaCare Physical Therapy offers postpartum physical therapy.
Having physical therapy during the trimester can be a great avenue to help to treat so that they don't have problems later on in life as well as with upcoming pregnancies.
Postpartum physical therapy is nothing new.
So typically in Europe, after you have a baby, it is standard practice of care there that when you're discharged from the hospital, you get a script for physical therapy after you have a baby. Here in the United States, unfortunately, we don't have that as a standard level of care. So by coming to a pelvic floor physical therapist in your fourth trimester, we can really look at what has changed in your musculoskeletal system from having a baby.
The therapy is customized to the patient.
Just for example, a patient comes in and has low back pain, but also has some urinary incontinence. We might work on the low back first and then do some strengthening exercises along with core, because our core and our pelvic floor are connected.
Postpartum PT benefits a mother whether the birth is vaginal or via C-section.
Your body gets cut through 7 layers when you have a C-section, and it's a major surgery, and you're in the hospital for less days than some surgeries. Sometimes your body just doesn't get the healing it needs. And so with pelvic floor therapy, we do a lot for the C-section scar. If there's any tenderness at the scar or any numbness at the scar, we can work on it. A lot of times C-section patients also have a lot of low back pain, so we can work on the low back. Again, working on the urinary incontinence issue, and a lot of abdominal weakness, because we do cut through, or they do cut through those ab muscles when there's a C-section.
The team at AquaCare Physical Therapy also understands how hectic a new mother's life can be.
Yeah, absolutely. I mean, when patients come in, we always say you're more than welcome to bring the baby, and if you need to nurse during your appointment, we want it to be a really warm and welcoming environment. And for the most part, we're all moms here too that are treating, and we get it. We get what it's like not having sleep and being exhausted. And the last thing you want to do is take care of yourself. But it's so essential in the recovery for your fourth trimester.
And pelvic floor therapy is not limited to new mothers.
A lot of times men and women will experience problems with urinary incontinence, pelvic pain, pain with intercourse, just in prolapse. And prolapse is where the bladder or the uterus may fall into the vaginal canal, leads to a lot of problems. So we work with men and women in strengthening muscles that we call the pelvic floor to help to impact on those type of problems.
Strength to help you through the fourth trimester or any stage in your life.
In the state of Delaware and Maryland, you do not need a referral from your physician for pelvic floor therapy. However, some insurances may require a referral. AquaCare Physical Therapy offers a free consultation to see if you may benefit from physical therapy.